All right, so we're gonna take a lacrosse ball. All right, we're just gonna kind of go around where the glute is there, not really rolling up on the actual bone itself, but getting really close to it and kind of getting in nice and deep to that glute. All right, so all you're gonna do is just set it up underneath your butt. Get your leg out, just kind of roll it all around. Nothing too crazy about it, just kind of, moving it around, feeling what's down there in terms of like, okay, what's tight. We're gonna get our hip flexors, all right, and then our adductors on the front half here. So just taking the lacrosse ball there, you're gonna be placing it, all right, right where the hip and the femur kind of meet up at the top there, rolling it around back and forth, all right, just kind of in that soft little tissue area. Here, you can see where I'm placing it. All right, just right underneath that hip. All right, and just working it around, sometimes flexing the muscle, then releasing it, just to see if I can get the lacrosse ball to get a little bit deeper and maybe massage it a little bit better. All right, so now we're gonna go over rolling out your quad and your adductors and stuff like that using a barbell. I think it's pretty simple. All you're gonna do is just get yourself a barbell. The further you are down on the head, it's gonna be a little bit lighter, especially with the bigger barrel. It's not gonna get in as deep. If you use the narrower part, it will get a little bit deeper in terms of like how much pressure is getting placed in that specific area. But yeah, what I do is just take my leg, work with my hands, moving it up and down. If I feel like it needs more pressure, I'll apply more pressure. But yeah, I'm just rolling up and down my quad. I'm obviously stopping before I get to my kneecap, and I'm getting pretty close to it. I'm trying to push that tendon out as well. Then just kind of moving my quad side to side. So getting it up here, all right, pretty close to that knee as well, getting the VMO of the side of the quad there. Just kind of slowly easing that and seeing if I can release some sort of tension out of that. All right, and then moving it over to the outer portion there, same thing on the outside, just kind of rolling it down and up. You can see I've placed my other foot underneath of my knee as just kind of like a support. So obviously my knee doesn't cave in, so it doesn't feel like super uncomfortable. So just kind of supporting it on the outside, getting close up to that hip and then rolling it back down. Really just getting anything that I feel is super uncomfortable or super tight. And if I want to, I can even take the IT band on the side and kind of do the same thing, rolling it up and down that side area there. Now as I move to the adductors, kind of on the inside, all right, everything's kind of the same. I'm just kind of contorting my body here on the side now so that the bar can like lay on the inner portion of my groin, and then I'm just rolling it up and down. Nothing too crazy. Obviously you want to make sure like your junk isn't going to get smashed there when you're doing. All right, so we're back now. We're going to be rolling out our calves now, just getting our soleus and our gastros just nice and deep. We're going to take the bar here, all right, just picking it up, all right, getting it to the back side of your legs, and then just kind of letting it sit, and you using the hand either inside or you can use both of them. It doesn't really matter, whatever's kind of comfortable for you. All right, but you're just kind of rolling it yourself. All right, taking it nice and slow over your calves. All right, taking it all the way up if you really feel comfortable doing that, all the way up to the bottom of the heel, and then kind of just floating it back down nice and slow. Getting any tight spots you feel, like right there for me. All right, and that's pretty much it to it.